physical examination of a male with intellectual disability, it was noticed that long face, large testes, and along with that CGG repeat expansions were noted by doing PCR testing. So what is the most probable diagnosis? So if you are thinking that the answer is Fragile X syndrome, that is option C, then your answer is correct. So let us now see what are the features of Fragile X syndrome, and the features of other syndromes we will discuss in a separate video, a separate clinical based question. So we will see the Fragile X syndrome and its clinical features with the help of a small mnemonic fragile. Okay, so the name itself is going to help you to remember what are all the important clinical features of Fragile X syndrome. So F stands for FMR1 gene. Okay, and next R stands for repeats. So this particular Fragile X syndrome, it's going to have repeats of CGG. So what does CGG stand for? Cytosine and guanosine. Okay, and the next is A stands for attention deficit hyperactive disorder. So this will be dealt in pediatrics, of course. Attention deficit hyperactivity disorder. Now G stands for gonads, and these gonads are going to be the characteristic large gonads, large testes. Okay, that you can remember with the help of this as a mnemonic itself, where C stands for congenital giant gonads. Okay, I stands for intellectual disability. Please remember in the earlier days, mental retardation was the term which was used, but nowadays this mental retardation term is replaced by intellectual disability, and FMR stands for fragile X mental retardation gene. So you can remember with the help of this that I stands for intellectual disability, and LE you can remember as large ears, and also please remember there will be large face also. So I will show you a picture how it will appear. So here you are able to see, one second, I will just remove this. So here you are able to see in the picture that there is a long face, which you are able to see. There is a prominent jaw which is there here, and also please remember there will be autism spectrum disorders also associated in Fragile X syndrome. Okay, so this is the question which I was asked today. So you can see the intellectual disability is there, and long face is there, large testis is there, and along with that CGG repeats are there, which were noticed by PCR testing. And all of these are seen in the male. Why? Because males are going to have only one X, and in the females you can see there will be two X, that is a pair of X will be there. That is the reason why it is going to manifest in males completely, whereas in females usually they are going to be carriers for this particular genes. And you should know these two important points. Most common inherited cause for intellectual disability is Fragile X syndrome. And if you are going to ask most common cause for intellectual disability, so the most common inherited cause for intellectual disability is Fragile X syndrome, and the most common cause for intellectual disability, irrespective of the inheritance pattern or it is sporadic nature, it is Down syndrome. Okay, these are the important one-liners and factual questions which you should know, and these are the data which you should remember. Okay, that's it in this session, guys. So if you like this video, please give a thumbs up.